Did you know your body's health depends on a microscopic layer most people have never heard of? The glycocalyx? Welcome to the future of vascular health. Healthy vessels, healthy future. The podcast where we uncover the science and secrets behind optimal vascular health, longevity, and vitality. Brought to you by the Glycocalyx Research Institute, founded by Dr. Hans Vink and Robert Long. This show delivers cutting-edge insights into microvascular health. Through solo episodes and expert interviews, we'll teach you how to protect your glycocalyx, improve circulation, and unlock better overall health. Tune in each week and discover how healthy vessels lead to a healthy future, because protecting your glycocalyx is the key to a longer, vibrant life.
Good morning, everyone, and welcome to our podcast today. We're excited to continue our series on diabetes as part of our ongoing series on the future of vascular health. So today we'll be talking further about diabetes and why it's a microvascular disease. And then we're going to get into the research that we've done and show you the impact that prediabetes and diabetes have on the glycocalyx. So we're going to answer the question, is diabetes really a glycocalyx disease? And I think what research we've done over the last 14 years, this was an area that Hans was heavily involved in when I first met him and his group, one of his PhD students, Bart. So I was really intrigued by what they were doing. And so we're going to share a lot of the data that we've done over time. So with that, I'm happy to have my partner and good friend, Dr. Hans Vink, with me today. So Hans, take it away, and then I'll just ask you questions as we go along, as we usually do.
Well, thank you, Bob. Good to be back and good to share some of the data that we were doing indeed in the early days when we met in 2011, 12. So just to summarize a little bit what we discussed last week, we discussed, about diabetes, also called diabetes mellitus, that, it's a condition in which your blood sugar or your glucose levels rise, and that's damaging your cardiovascular system. And today I want to show a little bit how it damages your glycocalyx, and also how that damaged glycocalyx, how that actually might contribute to people becoming type 2 diabetic. As you also mentioned, 90 to 95% of people with diabetes have type 2 diabetes. And that's not necessarily a problem with producing insulin. It's just that insulin isn't as effective anymore in taking care of your glucose levels. And some of the stuff we were doing at that time, we're really looking into that and to see how glycocalyx actually mediates that effect of insulin, how that helps you to clear your glucose levels. Again, we showed that about 34 million people in the US have type 2 diabetes, and that the estimated cost of diabetes is an astronomical amount of over $400 billion a year. So when we look at these people with type 2 diabetes, it's also striking that only about 20% of these people both know they are type 2 diabetic, they are being treated, and have their glucose levels under control. The majority of people either do not know they have diabetes, are not treated, or are unable to keep their glucose levels under control. So they're still suffering a lot of the consequences of that uncontrolled high glucose levels.
You know, what's interesting is what comes to mind for me is look at this slide, is I think this is reflected in the scores as we test. And I've tested hundreds of people, and I think there's a lot of people, and I think you'll get into it, that are pre-diabetic or might even be considered diabetic that aren't even aware they've got the issue.
Well, and these people are not even taken into account in this slide. This is all people with type 2 diabetes. And there's a lot of people pre-diabetic that are getting there. Their glucose levels are rising, not just at the threshold of the definition of type 2 diabetic, and they have a problem controlling their glucose levels. These are actually people with full-blown type 2 diabetes, and it just shows you that a lot of people with type 2 diabetes don't even know they are diabetic, and many of them that know and are actually getting some treatment are unable to control their glucose levels. So it's even worse than this. And of all these people, so why do we care? So why is having, type 2 diabetic does have so much risk of cardiovascular disease? And that's shown in this slide. This is all the different risks of cardiovascular complications that people with type 2 diabetes are exposed to. So the most important risk is coronary heart disease. That's on the top left. It shows that all the diabetics, about 14 to 21% of all diabetics have coronary heart disease. It also shows that the risk of death from coronary heart disease is higher in women than in men. Average odds ratio of, additional risk of dying from cardiovascular disease of diabetes is 1.8 times higher in people with diabetes in females compared to 1.4 in males. Also, a lot of people with diabetes have heart failure, a prevalence between 19 and 26%.
So
And
how
then,
would you define the difference for our audience between coronary heart disease and heart failure?
well, coronary heart disease, coronaries are the blood vessels in the heart. So those are coronary arteries. And like in one of the earliest podcasts that we did, we talked about atherosclerosis.
Right.
So you have blockages of cholesterol building up in the wall and then closing down those large blood vessels. And when those get occluded by, the plaque gets too big or there's a blood clot forming, it shuts down the blood flow to a significant part of the heart, and then that part of the heart dies, and you have a problem. That's coronary heart disease. Heart failure has to do with the function of the heart itself, the pump function. So how much blood the heart can pump. And there's two types. You have the heart failure with preserved ejection fraction and with reduced ejection fraction. And those are different types. Well, the reduced ejection fraction means the heart cannot pump as strong anymore. After you have a heart attack, part of your heart gets damaged, and then the heart fills with blood and needs to pump, but it's too weak, can only pump a small part of the blood in the heart, pump into the large blood vessels. So that's heart failure with reduced ejection fraction. Another very prevalent type is heart failure with preserved ejection fraction. So the pump force itself is not a problem, but the heart is very stiff, and when it dilates, it relaxes to fill with blood before it pumps it into the blood vessels. That's very slow, and so it doesn't open as much anymore, it doesn't fill. And that's due to fibrosis of the heart muscle, and there's a strong link with microvascular disease. So if your microvasculature is compromised, there's not as many capillaries also in the heart muscle, like in other tissues, like we discussed also in the kidney, for instance. When that happens, there's a lot of damage, and the body tries to repair the damage with scar tissue and fibrosis. So when that happens in the heart muscle becomes very stiff, and it's very difficult to relax during the filling phase. So it does relax a little bit, and there's a small amount of blood entering into your ventricle. And then it can really squeeze it all out in the vascular system, but it's a very small amount of blood. So that's heart failure. The pump function is compromised, not because it cannot contract anymore, but it cannot relax and fill. And that's mostly likely microvascular related. So that's another problem that people with diabetes have. We also discussed peripheral artery disease. So those are the other large arteries other than in the heart, going to your kidney, to your legs, going into your arms. If they get occluded, you have issues with perfusion of your extremities. Strokes are prevalent. 8 to 12% of people with diabetes get strokes. And then on the right-hand side, we have all the more microvascular related cardiovascular complications. On top, retinopathy, so problems with the eye. About 34% of people with diabetes have eye issues. So that's one of the most common microvascular complication that people with diabetes have. And that's responsible for about 2.6% of all cases of blindness worldwide. So it's a big deal that people with diabetes have a very high risk of eye problem and blindness. Um, in addition, a lot of people with diabetes get nerve issues with their nervous system, neuropathy. So their hands or feet become less sensitive. They don't even realize when they step on a piece of glass, for instance. So there's about 31 to 73% people type 2 diabetes get these neuropathies.
So, question about that, because I know a lot of people suffer with neuropathy, and I think there's a lot of people that are pre-diabetic or, like you mentioned earlier, have type 2 diabetes, but they're not doing anything about it. So neuropathy, can you explain the correlation between microvascular and neuropathy and why the lack of blood flow probably impacts the nerves so much?
Well, obviously, people don't really know, so we're speculating. But what makes sense is that also nerves need nutrition and need oxygen. So nerves have their own microvascular supply of nutrition and oxygen. So when your capillaries are damaged and disappear, also your nerves will be damaged, same as any other organ in your body. So I think that makes complete sense.
Yeah.
And then last but not least, we also talked about kidney disease before, nephropathy. So about 29 to 61% of people with type 2 diabetes get also kidney issues. So diabetes actually is the leading cause of end-stage renal disease in the adult population worldwide. So a lot of cardiovascular complications with the heart, with your coronaries, stroke, eyes, nerves, and kidneys. So that's why it's so important to pay attention to your diabetes and keep your glucose levels under control. So today, I'm going to discuss two major things related to that cardiovascular disease. First, I want to spend some time of the impact of diabetes on glycocalyx to show that people with diabetes have a compromised glycocalyx. Also, some of the data that we've shown before that not only your glycocalyx is compromised in type 2 diabetes, but also your capillary recruitment capacity. So you start losing capillaries, but also you cannot adjust your capillary exchange capacity when blood flow increases. And then the last part, I want to focus a little bit more on the relationship between insulin and glycocalyx. So even in a healthy individual, if you increase insulin when glucose goes up, so insulin is supposed to take care of the glucose disposal. Insulin does have an impact on your glycocalyx in a functional way. So it helps to clear your glucose. And then we did some experiments in the past with Bart Eskens and Jurgen van Tevelen to see what happens if you acutely damages your glycocalyx. How does it impact the function that insulin has, how it helps you to clear your glucose? So that leads me to the last point. So does insulin modulation of glycocalyx permeability or capillary blood volume contribute to insulin-mediated glucose disposal? So first, to test whether type 2 diabetes damages your glycocalyx, we used our glycocheck systems in the early days. Again, so we measured, the depth of penetration of the red cells in your glycocalyx as a measure of glycocalyx damage. And these are some of the early studies that we did with the glycocheck system shortly after we met Bob.
Yeah.
So we did some reproducibility studies. So we had healthy controls, and we measured one time, we measured a second time, one time and second time, and we had an average result, fairly consistent. And this shows that the PBR level or your level of glycocalyx damage is very limited. So PBR value is less than 2, 1.8.
What was the age group of the controls?
Now, these controls on the left were the younger ones. So I guess like in the 20, 30-ish years of age.
So theoretically, they would be considered in the prime of life.
Yeah. So the best health what you can have, controlled.
Right.
The middle group are also healthy individuals, but they were older, more in their 50s, 60s, 70s years of age. Just to match the same age of the early onset type 2 diabetes group on the right-hand side. So these are very early stage type 2 diabetics, without any cardiovascular complications. So they have still everything under control, just showing that compared with the effect of age, there's still a slight further increase on your glycocalyx damage in these type 2 diabetics. And I'll show you a little bit how a compromised glycocalyx might actually contribute to that lack of insulin sensitivity that these type 2 diabetics experience.
What's striking there is, we always tell people, when we look at the microvascular health score, our goal is to get people below 2.1 or 2. But even in this study, now this was done like in the Netherlands, and so but they were still below 2 on their
so
PBR.
And must say this was a very well controlled study. So not only were these people fasted for a while, they had controlled meals also for a while before the onset of these measurements. So we were following these people already for several weeks or months to keep everything as stable as well as controlled as possible, to see these small increases in PBR. But you're right. So under ideal conditions, these people with early onset type 2 diabetes still had their PBR values in the 2.0 range. While many of the people that we measure, well, we are pretty happy when they get close to that level, but that's not ideal yet. You really want to have them below 2, 1.9, 1.8. When we're in good shape, Bob, our PBR values are more in the 1.6, 1.7 range.
Right. And that's where I try to maintain mine, and I've been successful at getting it there and maintaining it there. But what's striking is in that control, what you just said, these were well controlled, meaning they were controlled with their diet and all those kinds of things. So that even shows the impact, even if they're type 2 diabetic, of paying attention to your diet and all the things that you were having them do versus people that go willy-nilly, do whatever they want.
I think it's also worthwhile mentioning, I'm not sure people realize that type 2 diabetes is reversible. It's not a progressive disease. So if you do realize you have an issue with controlling your glucose and your HbA1c levels, so your glucose levels on your red blood cells start rising as a measure of poor control of your glucose. If you do start paying attention to your diet and exercise and lose some weight, preferably by doing exercise, many studies shown that you can actually be cured from being type 2 diabetic. So, it's all about control and getting all the risk factors under control, and then you can get rid of your type 2 diabetes.
Yeah, I've read all of the books by Jason Fung. He's an endocrinologist that's studied diabetes for a very long time, and he's absolutely convinced you can and should be able to reverse type 2 diabetes. And he's a big advocate of intermittent fasting because that helps control the glucose levels. So
and that's the other thing, and we'll talk about the impact of insulin on glycocalyx and glucose disposable. So the way your body is designed, you're not supposed to have high glucose levels or high insulin levels throughout the day, all day long. So just only shortly after you eat a meal, then your glucose levels go up, and then your pancreas senses that and give a little spike for a few minutes of insulin to take care of that, and it measures again, and if that's not enough, it gives another little spike. So only a few minutes your insulin goes up and then it goes down again, and if that's enough, it's repeat. But it's a completely different story than having raised insulin levels for hours, and that's gonna contribute to the damage. But we'll get back to that in a minute. So even at these levels of controlled level of glycocalyx damage in type 2 diabetes, we did measure their capillary recruitment capacity. So
can you define capillary recruitment capacity again for our
for those. So that's what this slide is all about.
Okay.
So this is on top, it's just for a healthy individual. So on the left-hand side is a capillary bed at low blood flow level, so at resting or fasting even before glucose intake. So blood flow into the capillaries is slow, like 80 microns per second in this example, and it shows that out of the 3 available capillaries, so anatomically there are 3 capillaries, but we know under resting conditions many of your available capillaries don't show up with the glycocheck because there's no red blood cells in them, so there you don't see them, and that's because there's a lot of glycocalyx filling up that space and very little volume for blood flow under resting conditions. So in this example, only 2 capillaries have red blood cell perfusion and are counted by the glycocheck system. So and then on the right-hand side,
If I can stop you there, I think that's an important point for our audience, especially those that have glycocheck devices. We can only see and measure the capillaries when there's blood flow in them, and that's why you see a difference. That's why you'll notice there's gray and dark. So I think that's a big part of what you're talking about.
Yeah, so that's indeed how we all started. If you look at the microvascular tissue under resting conditions, you only see those capillaries where red blood cells are flowing. And many of them you don't see because there's no blood flowing through them at that time. And even the ones that are perfused, the gap between individual red cells can be quite significant. So you only see once in a while a red cell going through. And that's all because glycocalyx occupying the majority of the volume, 2/3 or even more of the volume of your capillaries are filled with glycocalyx. So, and where glycocalyx is, there's no red blood cells. But in a healthy individual, when there's an increased need for perfusion, when there's increased metabolism during exercise, or when glucose levels go up, and you need to be more efficient in transporting the glucose from the blood to the tissues, then more capillaries are used. And also, all of the used capillaries, there's an increase in blood volumes. There's more red blood cells per perfused capillary. And that's shown on the top right. So this is when blood flow goes up, high blood flow. Not only blood flow goes up, but more capillaries are perfused. And typically what we see is that there's a proportionality between the increase in blood flow, so the liters per minute flowing to your tissues, as measured at the entrance of your capillary network, the larger vessels. So it goes up from 80 to 120 microns per second. So if you look at the relative increase, that's a 50% increase in blood flow. And so 50% more blood per minute going to your capillaries. But at the same time, there is one more capillary. So there is also a 50% increase. Instead of two, it's three capillaries. So 50% increase in the number of capillaries where the blood can flow through. So per capillary, the flow stays fairly constant. So that's how we define capillary recruitment capacity. We look at the percentage increase of capillaries compared to the percentage increase of the blood flow in the larger vessels. And in this case, that's 100%. So there's a 100% increase in capillaries perfused per 100% increase in blood flow. So that's proportional, and that then you have a recruitment capacity of 100%.
So when you have a challenge or your brain tells to speed up the blood flow, the blood flow red blood cell velocity goes up, so that's the speed, and so that's
well, only in the larger vessels. So
only in the
surprisingly, the
larger
velocity in the
vessels.
capillary stays very constant.
Right. So it speeds up in the larger vessel, which then feeds the capillaries. And that's what then, if you've got functional reserve capacity, that's what then puts the red blood cells into additional capillaries. So you've got a high reserve capacity.
Yeah, and that makes it much easier. You have more capillaries, there's more contact area between where the blood flows and the tissues, then more wall of capillaries is being exposed to the glucose and the oxygen. So much easier to transport. Well, even at minimal levels of glycocalyx damage, like in the onset of type 2 diabetes, but also this starts happening with aging. So you still have a relatively normal level at on the resting conditions, but in this case, there's a drop in capillary density because, for instance, of diabetes. So even at resting, low levels of blood flow, only one capillary is being perfused. The other ones that used to be there are not available anymore. They're damaged, they have been destroyed, they're not available anymore for blood flow perfusion. So when there is an increase in blood flow, what happens still when glucose goes up or you exercise as a type 2 diabetic? So here the blood flow goes up from 50 to 100, so it's a 100% increase in blood flow. You still only have that one capillary being perfused. There's no other capillaries that you can recruit. So then the only thing that happens is that the blood flow in this individual capillary also increases twofold, and the blood just flows faster through this one individual capillary, and there's less time for exchange. So there's no benefit of increasing your blood flow. It's actually a bad thing because it's less time for exchange. Exchange becomes less efficient when that happens. And in this case, there's a 0% increase in the number of capillaries, while there's a 100% increase in blood flow, and then you have a 0% recruitment capacity.
Yeah, so I was talking with a physician yesterday, and I was kind of explaining the context of this without having the pictures to show him, and he wanted to know if it was a good thing or a bad thing if your red blood cell velocity went up. And I said, well, if you have a compromised microvascular system, that means exactly what you said, is it's illustrated by the far bottom right slide. It just means the blood's going through faster. And the example I always give is, I grew up in Utah, we irrigate. So it was pounded in my head from an early age that when you irrigate, the blood's got to get the water's got to get to the end of the row, and then it's got to soak, because it's got to last all week until you irrigate again the next week. Well, what's happening with people that have microvascular dysfunction is it's not giving it just exactly what you said. We're not giving time to support all of those cells and tissue and everything that needs to be supported with the oxygen, nutrients, and hormones, and also the removal of toxins and CO2. So that's why it's so damaging. It's a crescendo effect. We talk about that spiral that we use. This illustrates it perfectly.
Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your glycocalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit glycocalyx.com to learn more about Revasca and how it can help you protect your future.